Becky, over to you. We're fortunate ministers that we've got Becky Cooper guesting from Health.
Yes. Hi.
You can't escape from her. She'll find you.
Thank you, Chair. It's good to hear that AMR is so high on the top of your agenda, or I suppose not good, but it's a necessity. So antimicrobial resistance. Can we please hear about the closure of the Fleming Fund? So I know that it's been central for global efforts to build lab capacity, enable data sharing and strengthen surveillance systems across low-middle income countries. The Global Health Partnership had a UK-Africa Health Summit and looked at antimicrobial resistance and really flagged the Fleming Fund as something that's been a huge success in terms of really getting to grips with those surveillance systems and that crucial data collection. So could you please let the committee know the decision to close that Fleming Fund and what was taken into consideration when the decision was made?
Yeah. So we've done an awful lot of work with the Fleming Fund, as you'll be aware, and Dame Sally has led some amazing work on that. I actually co-chaired a breakfast on AMR specifically at the World Health Assembly earlier this year to share some of the expertise and work again with our global counterparts. What we have learned in terms of the Fleming Fund is that it's done some amazing work to build the partnerships that we need, to get the evidence and the technical information that we need in order to establish what needs to go on moving forward, and more importantly to build the relationships globally, because obviously this is something that needs to be done on a global level. So whilst the Fleming Fund itself isn't continuing, the partnerships are, the information is, and the expertise is. And if you come in a little bit more detail, and I know that Dame Sally is continuing to build on the relationships she's built on a global stage.
Yeah. So you're saying there's nothing to see here and everything's fine?
Well, what I'm saying is that we are all working in a difficult financial situation, and some choices have had to be made. What I'm saying is that in terms of the work that we've done with the Fleming Fund, there's an awful lot that we can take forward in terms of what we've learned from that, without actually continuing with the actual fund itself to carry on.
Sorry, thank you, Chair. So the data that have been amassed and the surveillance systems that have been strengthened through the Fleming Fund, the funding to continue that data amalgamation and collection and surveillance strengthening and fortification, that funding will continue elsewhere, or that funding will not continue and we will simply take what we've learned and change into a different model?
Yeah, I mean, the Department for Health and Social Care is looking at how we streamline AMR into the tailored country pandemic responses, so that it becomes something that countries across the globe are doing, not something that's sitting outside of that. And we've got a wide network of partners, really maximising the opportunities for sustainability. What we want to do is mainstream that work into the work that other countries and ourselves are doing in terms of things like pandemic preparedness. And I know that the FCDO are exploring how they can best integrate the expert technical support to transition from the Fleming Fund to sort of country-based ownership. I don't know if you want to give a little bit more detail on that, Anna.
Yeah, so I mean, the Fleming Fund has done a huge amount over 10 years. It's really been, for a long time, the only programme of its type really investing in the production of surveillance data on antimicrobial resistance in a wide range of countries. And we've had quite a lot of successes. So in Malawi, for example, and in Timor-Leste, we've got systems up and running now producing data, and those are reporting into the global databases held by WHO and others.
And that will continue to happen?
So we have right from the beginning tried to build in sustainability. All countries have national action plans, and we are pushing for those to be funded. I mean, you know, there's no hiding the fact that this is a reduction in the funding that we are putting in, but we are working, as the Minister says, both through our own programmes, including the International Health Regulations Strengthening Programme, which we will continue to run from DHSC, to look at where we can pick up some of that AMR work, but also really importantly globally and through WHO and through other funding partners, so that work doesn't just fall away.
Okay, and perhaps if I could just follow on then, looking sort of for global health and security, as well as specifically at AMR, through the Global Health Security APPG and through the AMR APPG, we've been discussing with the Cabinet Office around the National Security Strategy and where AMR fits into that particular approach. And I just wondered, perhaps Baroness Chapman, from an FCDO point of view, how you sort of see AMR as a global threat, but also a threat to UK health security as well, and where those conversations are landing.
I mean, you're right. I think in my response to the first answer, I agree with you. It is a huge problem, not just for us in the UK, but for other governments are experiencing this too. And some of the ways we're working is trying to do the expertise sharing, so looking at regulation, looking at prescribing, working with other governments on how what steps that they can take, learning from our experience and sort of sharing that expertise with them. The work that we're about to start over the summer is looking at what the expertise offer is in the UK, and there'll definitely be something on health, of course, but exactly what that looks like is something I'm quite keen to spend quite a lot of time working out. So what is it that the UK can offer which is specialist and would be most in demand around the world? And I think what we've done on antimicrobial resistance and our work to understand it and to work out what the practices need to change, I think that's something that we should be doing a lot more work on and trying to make sure that that is shared. What exactly that looks like, who's involved, it won't just be, I hope, a couple of government departments employing some people. This needs to be something that we look around the whole of the UK system and partners elsewhere as well, and try and get the very best expertise we can available where it's urgently needed.